PULSUS paradoxus. It is the exaggerated fall in the systolic blood pressure during the inspiration. When this fall in the systolic blood pressure is more than 10 mmHg, it is called the PULSUS paradoxus. Before going to the detailed discussion of PULSUS paradoxus, we have to know the relationship between the blood pressure and the respiration. As we know, during inspiration there is downward movement of diaphragm and expansion of the chest wall occur. That leads to the decrease in the intrathoracic pressure during the inspiration, and during expiration opposite occur, that leads to the increase in the intrathoracic pressure. During inspiration there is decrease in the intrathoracic pressure that results in increase in the venous return. This blood, venous blood via the IVC and the SBC comes to the right atrium and eventually that goes to the right ventricle. During inspiration, lungs also expands, that leads to the dilatation of the lung vessels. As these vessels are high capacitance vessels, it holds much more amount of the blood. As the blood from the lung goes to the left atrium, that leads to the decrease in the volume to the left atrium. Ultimately, there is decrease in the volume of the left ventricle. During inspiration, there is increased volume to the right ventricle and decreased volume to the left ventricle. That results in deviation of the septum towards the left, also further decreases the left ventricular volume. Ultimately, there is decrease in the cardiac output and that leads to the decrease in the systolic blood pressure during the inspiration. Opposite thing occurs during the expiration. During the expiration, there is increase in the intrathoracic pressure that leads to the decrease in the venous return. Ultimately, right atrial volume, right ventricular volume decreases. So, the septum is not deviated that much, that is seen during the inspiration. There is recoiling of the lung occur during the expiration. That results in constriction of the blood vessels. So, the blood from the lungs goes to the left atrium much more in amount than during the inspiration. Ultimately, the blood volume to the left ventricle increases, that increases the cardiac output. So, during the inspiration there is decrease in the systolic blood pressure and during expiration there is increase in the blood pressure. In normal individual there is seen some gap. When this gap increases more than 10 mmHg, that is called the PULSUS paradoxus. During inspiration, as there is much more amount of the blood coming to the right atrium, increase in the volume to the right ventricle. As the volume increases, that also builds the pressure inside. So, the right ventricular pressure increases, but the pressure is equally distributed throughout the wall of the right ventricle in normal individual. But if there is any situation occur where the ventricle is not able to expand properly, so the pressure built inside the right ventricle is not able to go outside. So the maximum pressure will go towards the septum and the septum deviates much more in amount towards the left side. So during inspiration, in this disease state, there is exaggerated deviation of the septum towards the left ventricle, and as there is limitation to expand the ventricles, the left ventricular volume decreases much more in amount, that leads to decrease in the cardiac output, and ultimately the systolic blood pressure decreases much more than as seen in the normal patient. This is usually seen in the cardiac tamponade. The causes of PULSUS paradoxus are: it is seen in the physiological condition like the obesity, pregnancy. The respiratory causes are bronchial asthma, emphysema, COPD, large bilateral pleural effusion. Cardiovascular causes are cardiac tamponade, constrictive pericarditis, hypovolemic shock, pulmonary embolism, right ventricular infarct, cardiomyopathy, SBC obstruction, post-thoracotomy.